Joining us now with more on the Pfizer-BioNTech vaccine is Dr. Ian Miskin, head of the coronavirus response team at Clalit Health Services, Jerusalem District. Doctor, thank you so much for being with us. Now, first of all, I don't know if you were just watching, how did we do on our breakdown of the Pfizer vaccine?
Pretty good. You went according to the New England Journal article, which is one of the best medical journals in the world. So anything that's published there is considered peer-reviewed and very, very trustworthy. I've taken that article apart and put it together again in my lectures to my health teams, because we feel that there's another aspect of this whole thing, this whole coronavirus and vaccination setup that people don't quite realize. This is not a flu vaccine, which if you don't take it, if you do take it, there's 20%, sometimes 50% effectiveness. But if you don't take it, then you may get the flu. Here's a choice between getting vaccinated or getting sick. There's no third option. You either get vaccinated or you're going to suffer from the disease. So you're not comparing the vaccine or its possible side effects or after effects to not taking the vaccine at all. You're comparing it to getting sick. And we do know that about 50% of patients will be symptomatic and 50% will be asymptomatic. Of the 50% who are symptomatic, approximately a fifth, in other words, 10% of those who are getting sick, will have long-term effects of this or that or the other kind. Some may be just muscle pain for months. Others may have a loss of smell for months, but it's not a question of having nothing. So if you compare this to the vaccine, there's no question at all what people should be doing.
So, are you satisfied then with the safety checks behind the Pfizer-BioNTech vaccine? Are you satisfied with the amount of evidence that has been collected thus far? And are you confident that that's not really going to change too much long term?
I'm confident that everything that could have been tested was tested. Normally, you have to wait a long time to see positive cases so you can compare the groups. And this time, this setup, there was a huge number of cases, so they were able to get to results very quickly. And the long-term follow-up, obviously, it's still going on. It's either 7 days for everyone reported, or a month of side effects that weren't expected, and severe side effects were reported for 6 months. This is, of course, still ongoing, but we're not expecting any surprises at all. We're looking at the way that this vaccine actually works, and it's as you mentioned in your previous report, there's absolutely nothing from the virus in there, except we have a way of manufacturing a slightly changed protein, which is on the surface of all the vaccine particles, and this will enable the body to target it and destroy it.
All right. So I think one of my final questions here is, with respect to dispensing the actual vaccinations to the public, is it going to be first come, first serve within each eligible group, or are the HMOs as Clalit going to be being more proactive, and they're going to be contacting the eligible groups when they become eligible to come in?
Well, I'm on the committee that decides this from the Ministry of Health. So you're asking me in two different ways. Put it this way: Clalit and all HMOs will give out the vaccine as according to the Health Ministry, the way they decide in which order. We know that 90% of those who died were over the age of 60. So obviously the over 60s will be targeted first, maybe first of all the over 80s, because we have an opportunity to stop people dying this winter from coronavirus. And obviously we'll be going for those who have the greatest risk of dying. This will be done by age more than anything else. In other words, I can expect the over 80s to be the first population to be targeted, together with healthcare workers and people living in old age homes, retirement homes, and the people who are taking care of them. These will obviously be our first priority to vaccinate.
All right, Dr. Miskin, thank you so much for speaking with us.
Good night. Thank you very much for inviting me.